In this video, I'm going to explain 5 key symptoms, 5 warning signs, that can indicate fatty liver disease. Fatty liver is far more widespread than most people realize. In fact, research shows that up to 60% of adults are affected by fatty liver disease, a number that surprises many people. If fatty liver is not taken seriously, it's important to understand the risk clearly. Without timely treatment, it can seriously damage the liver. In advanced stages, fatty liver can progress to liver cirrhosis, a condition where healthy liver tissue is replaced by hard scar tissue. At that point, reversing the damage becomes nearly impossible. This is exactly why recognizing these 5 warning signs is so important. Early detection can prevent permanent and irreversible liver damage. What exactly is fatty liver? Under normal conditions, liver cells contain little to no fat. However, when fat accounts for more than 10% of the liver's total weight, it's considered fatty liver. There are 2 main types: non-alcoholic fatty liver disease, NAFLD, alcoholic fatty liver disease. Non-alcoholic fatty liver is the most common form and is mainly linked to lifestyle-related factors such as poor dietary habits, high cholesterol, obesity, diabetes, insulin resistance. Alcoholic fatty liver, as the name suggests, develops due to excessive alcohol consumption and is seen in people who drink heavily over long periods. This brings us to the most important question: how can you tell if you have fatty liver? In most cases, people don't realize it at all. That's why the symptoms I'm about to explain are so important. They can help identify fatty liver at a very early stage. Pay close attention and remember each one carefully. Symptom 1: persistent fatigue and weakness. One of the most common signs of fatty liver is constant fatigue. You may have seen people who feel exhausted throughout the day, even after getting a full night's sleep. Their body feels heavy, their energy drops sharply by afternoon, and despite eating well, they continue to feel weak and drained. They often appear tired and unwell. If this sounds familiar, there's a strong possibility that fatty liver may be developing. The liver plays a crucial role in digesting food and converting it into usable energy. When fat builds up inside liver cells, the liver becomes less efficient. As a result, the body receives less energy, leading to constant tiredness and weakness. Fatigue can occur for many reasons, so how can you tell if it's related to fatty liver? If your tiredness is continuous, doesn't improve with rest, feels like deep internal weakness, comes with poor concentration, brain fog, or reduced mental clarity, then this pattern of fatigue is often associated with fatty liver. Many people describe it by saying, "I just don't feel motivated to work anymore. My body always feels heavy." If you relate to this, it's wise to stay alert and consider testing for fatty liver. Symptom 2: dull pain or heaviness in the upper right abdomen. This is one of the few noticeable physical symptoms linked to fatty liver. People commonly experience a sense of heaviness or pressure just below the right ribcage, a mild swelling-like sensation, a feeling of fullness or internal stretching. Discomfort often becomes more noticeable after eating oily or heavy foods. One important detail to remember: this pain is not sharp or stabbing. Instead, it feels dull, heavy, and uncomfortable, not like severe cramps or kidney stone pain. If this sensation persists, it may be related to fatty liver. Symptom 3: digestive problems. Fatty liver and digestive issues frequently occur together. In fact, digestive disturbances are often among the earliest warning signs of non-alcoholic fatty liver disease. People with fatty liver commonly report acidity, gas, bloating, constipation. This happens because fatty liver reduces the flow of bile. Bile is essential for breaking down dietary fats. When bile flow is reduced, oily and heavy foods are not digested properly. So if you often experience frequent acidity, regular bloating, a heavy feeling after meals, reduced appetite, heaviness in the upper right abdomen, there is a strong chance that fatty liver may already be developing. Symptom 4: belly fat. This symptom concerns many people, and rightly so, because it's extremely common. Belly fat, what doctors call central obesity, is one of the strongest and most visible warning signs of fatty liver disease. In medical terms, it's often said that abdominal fat reflects liver fat. Both conditions share the same root cause: insulin resistance. Many people say, "My body looks normal, but my belly keeps growing." If the rest of your body appears fairly fit while your abdomen continues to expand, there is a strong connection to fatty liver disease. Symptom 5: no symptoms at all. This is the most important sign of all. In the early stages, most people with fatty liver experience no noticeable symptoms whatsoever. So if you don't recognize any of the first 4 signs, it does not mean you're in the clear. In fact, this is often when the most damage occurs, because people become careless. That's where routine blood tests become essential. I strongly recommend getting basic health tests done at least once a year. In fatty liver cases, liver enzymes like SGOT and SGPT, also called AST and ALT, are often mildly elevated. Triglycerides, LDL, and VLDL cholesterol levels are usually high. Fasting blood sugar and fasting insulin levels are often elevated. Most people with fatty liver also have insulin resistance, high fasting sugar, and high fasting insulin levels. That's why annual testing matters. Even if you feel perfectly healthy, don't ignore these warnings. Catch the condition early, and with the right care and lifestyle changes, it can be reversed.